So when we think about an immune response to a vaccine, we really want two components, two parts of the immune system to be activated. The first is called neutralizing antibodies, which means antibodies are proteins that can actually kind of inactivate the virus. And the second is the activation of what's called natural killer T cells, special type of immune cells that can also help fight the virus. And this vaccine was able to trigger both of those. Antibodies are proteins made by the immune system in response to an infection. Now, there's different types of antibodies. Some are just a marker that the immune system has seen the infection, but others, those are the types that we look for, are called neutralizing antibodies because they can actually go and inactivate the invader. So they can go and mark the invader for inactivation so that the rest of the immune system can then kind of clear that. So those are the types of antibodies we want to see with this virus. And with this vaccine, we actually got those antibodies. Now, the outstanding question from this trial remains whether we have enough of those antibodies to prevent infection and whether we have enough of those antibodies for the person who gets the vaccine to also not infect others. And the reason that this comes up is because when you look at the monkey trials of this vaccine, where they injected the vaccine into monkeys and then exposed them to the virus, what they found was that the monkeys also had similar neutralizing antibodies. They were a lot less likely to get severe pneumonia or get super sick from the infection, but you still found viral secretions or viral particles in their secretions in their lungs and in the other parts of their body. So the antibodies didn't appear to be enough to completely neutralize the virus, which means that you could potentially still be infecting others, even though you yourself don't get as sick from the virus. So T cells are part of the immune system that's called the innate immune system. And these are the types of T cells that are basically like your soldiers in the war. So they go and actually fight the war. They're the troops on the ground that would actually go and inactivate the invader. So I'm skeptical because I want to wait for the results of the phase 3 trial before we really, put our money down on this vaccine. This is really promising. The results are optimistic. They're checking all the right boxes. But the phase 3 trial is going to tell us whether they're enough, they're lasting a long time, and whether they actually work to inactivate the virus. All this is telling us is that the body is triggering an immune response in response to the vaccine. Now, the other thing is the majority of people in this trial only actually got 1 dose of the vaccine. And what the authors suggested is that you really need 2 doses of the vaccine in order to have enough of those neutralizing antibodies, similar to somebody who's actually, been infected with coronavirus and recovered. There are slight scientific differences in the Oxford vaccine compared to the Moderna vaccine, which is the other front runner, and that's the one that's already going to enter clinical trials this month here in the United States. And the main differences are just how the genetic material, what it is and how it's being delivered into the body. So the Moderna vaccine is called a messenger RNA vaccine, which means they've taken just a small component of the genetic material of the virus and basically injected that into the host. The host picks up that genetic material and actually makes that protein. And then the host's immune system makes antibodies against that virus protein. And that's the spike protein that the virus uses to enter cells. The other vaccine from Oxford is slightly different in that they genetically engineered a chimpanzee virus. So it's actually a virus that doesn't infect humans and it can't make you sick, just like the mRNA vaccine. But they've actually genetically engineered the entire virus to look similar to the spike protein of the coronavirus. And so in that way, by injecting a virus that doesn't make you sick, you can then, mount an immune response against the viral protein. So they're both similar concepts where you basically teach the immune system how to fight the viral protein, the spike protein, the one that it uses to enter cells, but they're slightly different ways of doing so. I think a lot of it is because of the market pressure to produce the vaccines, because they're really, as you know, Oxford has already provided funding for a lot of these promising vaccine candidates. And one of the reasons that a lot of people are putting the cart before the horse, so to speak, and manufacturing the doses before they've actually already entered clinical trials is because that's a bottleneck that we commonly see, where after you're done with the clinical trial, it takes months, if not years, to actually manufacture and distribute the vaccine. So we're actually looking ahead on the horizon and really trying to plan based on what the science is telling us of what the most promising candidates are, which ones to manufacture. Now, certainly this could be a wasted effort, because if a safety signal emerges in phase 3, or we realize that it's not actually working to protect people, those vaccine doses would, not be utilized. One of the reasons that they're able to rapidly manufacture these vaccines is because they have the blueprint for the coronavirus based on MERS and SARS, which are viruses that we no longer have to worry about, but they had started vaccine development for those viruses. So that has really created a shortcut, so to speak, for them to be able to manufacture this particular coronavirus vaccine more quickly. And as we've seen, the science has really been accelerated, because what we're seeing here usually takes years and years of scientific research, and we've done it in a few short months. The reason we don't know is because this is a novel virus, and so we don't know how long the antibodies are going to last. Could they last a few months, a few years, or for the rest of your life? And we also don't know if the antibodies to natural infection will be different than the ones that we, develop in response to the vaccine, in terms of how long those last or what type of immunity they offer. What we do know from the SARS and MERS viruses, as well as the viruses that cause the common cold, all the other viruses in the coronavirus family, is that these antibodies can usually last 1 to 3 years based on these other coronaviruses. We don't know yet for the SARS-CoV-2 coronavirus how long the antibodies are going to last. And that's one of the reasons, even after you've had the infection, you may still, contract it again, or you may still infect others. We also don't know if the types of antibodies that you develop after the infection are the correct type of antibodies, those neutralizing antibodies that we're looking for. So let me just say a couple words about safety in this vaccine trial. The vaccine was very well tolerated, but 70% of the people did have nonspecific symptoms like fever, muscle aches, and chills. And that is not coming from the vaccine itself. Those symptoms, remember, the vaccine can't infect you, so they're not coming from the vaccine itself. They're actually coming from the immune system getting activated in response to the vaccine. And we've seen this with other viruses. Sometimes when you get the flu virus, you can have those nonspecific symptoms. So by no means is this a deal breaker at all. The other thing to keep in mind is if this vaccine does appear safe in clinical trials, but doesn't offer you full immunity to protecting others, we may end up in a phase in a few months where we all get the vaccine, but we're still wearing masks and doing social distancing to protect others. We also have to keep in mind that with multiple vaccine candidates being developed, what is most likely the outcome of this is that we're going to have multiple vaccines out there. And specific vaccines may be better for certain groups, and specific vaccines may be better for others. So keep all that in mind, that likely there are going to be many candidates out there, and likely even once the vaccine comes, we may have to think about wearing masks and social distancing. So that is something that should become part of our culture at this point, and we really need to start embracing it, because the vaccine may not necessarily be the magic bullet to make this thing go away 100%.